was given to me was a very challenging topic. I know that I have some beautiful and young mind in the audience. Okay, if you're going to be with me, you will follow that. It's a great topic. Am I right? So I would like to thank you, but it's a very challenging topic. Okay, I just want to let you know, guys. I would like you to ask questions. If you have any doubts at the end, I want you to talk. Unless you reciprocate, I'm just going to talk. It's useless. We are here. They gave me an opportunity to make sure that you can understand. It's not for us, it's for you. At the beginning, I'm just telling you, this is not for us, it's for you. Utilize this opportunity. Thank you, Chairman. Thank you, sir, for giving this opportunity. Okay? So let's start with, I'm from Auburn, Alabama. Okay? We are in South, very close to Atlanta. I'm from Harrison College of Pharmacy. It's one of the top 25 school of pharmacy or college of pharmacy in the US. Thank you, ma'am. Thanks for the kind words. So let's start with the first word. How many of you understand? Guys, you are a healthcare professional. I just want you to make sure that you understand at every moment of time. As a pharmacist, sir was telling in the morning, am I right? First, you have to start believing you are a professional. You are a healthcare professional. Am I right, sir? That's what you wanted to tell the students, am I right? So now, let me start from first word. What do you understand by the word virus? Okay? Before we start into the therapy, how many of you can understand the word virus? Okay? It is a non-cellular entity. It is a living organism. What is the most important thing as compared to bacteria and virus? Virus requires a host. That makes the whole therapeutic aspect completely different. So the first thing that I want you to take home, maybe after 20 years you remember that, virus requires a host for the survival. So now we are talking about a viral infection. We want to make sure that we understand the concept. So definitely I want you to make sure that you understand it is not a cell, it is a very small infectious agent which requires a host. So now the word corona, what does it mean? CO stands for corona, the VI virus, the disease 2019. The first case was reported, you know that in China, Wuhan, China. Okay? Why is it called pandemic? If you guys remember the word pancytopenia, the word pan, which means all, cyto, cells, penia, decrease. So I just want you to understand that do not start memorizing. Try to understand each and every word that you are studying. The sir was telling that you have to recollect. Jayavalan sir was telling that after 20 years, the science that you are learning, it is not to be memorized. It has to be understood. It has to be, you have to conceptually view that. It's all concept based. So the word pan, you have studied in pancytopenia. Pan means decrease in all type of blood cells. So this is pan. All people are affected because of this particular global issue. So definitely the topic that was given to me was a great topic. As a healthcare professional, as a beautiful young mind, how do you want to treat this particular pathological condition? So now, I want you to understand now, what is the challenge that we are having with COVID-19 as compared to the other viral infection. So the challenge here is, you have to understand that the challenge, the raw number, right, for a flu is approximately 1.3 every time we get infected. Whereas for COVID-19, it was 2 to 2.5. The incubation time was 1 to 14 for COVID-19. The hospitalization rate and the fatality rate was extremely high for COVID-19. Because you are in pharmacy, with regard to viral infection, there used to be a joke when we enter college. A treated viral infection stays for 1 week and an untreated cold lasts for 7 days. So the concept is, it is a self-immunity or an innate immunity that has to kick in to treat any viral infection. However, with regard to COVID-19, these two are a major problem. The hospitalization rate, the pathology of the disease was very severe. We couldn't control that. Okay? The body's immune mechanism couldn't control that. Number two, the fatality was extremely high. So now, the topic was a great topic. How do you differentiate? You are a healthcare professional who's studying about the drugs. You are the master of the drugs. You are the boss of the drugs. Whatever word you want to use that. So the topic today is what makes the normal viral drugs different from a COVID-19 viral drugs. That's the question that I just want to make sure that we understand. Okay? So with regard to the structure, so the question now is, why do we need to know the structure of COVID-19? Because we want to know how it interacts with the human cells. So the concept here for this particular slide is virus requires a host. So now, based on the structure of the virus, how does it interact with the host cells? So try to understand a thief entering into your house. Alright? So COVID-19 has to penetrate into a cell membrane to make sure that it dislodges its genetic material so that it can thrive, it can grow in the humans. So that is the concept here we are talking about. So we know the structure. We know the genomic organization. So now, as a healthcare professional, now the medicine, the treatment has become individualized therapy. Why do we say that it's individualized therapy? The ability for us to absorb, distribute, metabolize, and eliminate a drug is very different from each other. Alright? So the dosing has to be changed based on the absorption, distribution, metabolism, and elimination of the drug. So we not only have to know of the genomic structure of the virus, we should also understand the genomic structure of the human. How the medicine is being absorbed, distributed, and metabolized by the human. So the genome of the virus has been well characterized. But what is the problem happening here? Mutation. Alright? So COVID-19 is very different from Omicron. So we have mutations happening throughout this particular genomic structure. So now, based on the big picture, what are the strategies currently available to treat a viral infection? Number one, penetration of the host cells. Can we block that? Number two, viral uncoating, which means virus is transferring its genomic material into the host cells. Can we stop that? Then the virus has to thrive. The virus has to grow. For the virus to grow, it has to make sure that it can synthesize the nucleic acid protein and it can release the virus. So if we can block any of these steps, right? So start visualizing it. So number one, we can inhibit the virus to enter into the host cells, block the uncoating, block the synthesis of the protein and nucleic acid, and block the release of the virus from the host cells. Thereby, we can treat a viral infection. So that is the big picture that we have. So you can see the same thing. Binding is being blocked, fusion and uncoating can be blocked. Okay, so the RNA migration, the nucleic acid proteins synthesis can be blocked, the release of the virus can be blocked. So this is the current therapeutic strategy. So try to understand the big picture, how we treat a viral infection. So based on that, we have several drugs that are currently used as an antiviral drugs. So the problem again, try to understand that, can these drugs be used to treat a viral infection? Yes. But can they be used to treat COVID-19? The question here is COVID-19. So now, let's understand what is the role of, as a pharmacist, what is the role for you? A reason for your syllabus. What is the reason for your syllabus? You study physiology, you study pathology, or anatomy, physiology, and pathology. That's what we went to. We are trying to understand the microbiology too. So based on that, how do we integrate our chemistry, pharmaceutics, pharmacology, and not only that, currently, how do we integrate genomics into a therapy? So the concept here is, how do you see the pharmaceutical chemistry, your pharmaceutics, what is the dosage form, what is the dose, that is pharmacology, and then depending upon how the drug is being metabolized, you also want to know about the genomics of the patient. So based on that, I just took two drugs, okay, with regard to the viral infection. Let's look into amantadine, and I also want you to compare with remantadine. So as a chemist, if you're studying chemistry, it's a simple structure, okay? You can see that it is adamantine. It's a simple structure. Because the structure is very simple, am I right? The body does not need to metabolize the drug. So when your faculty is telling you, or when your professor is asking you to study the structure of a drug, there's a reason. When a drug becomes a very small molecule, am I right? Number one, when the drug is not a very aromatic or a complex molecule, your body does not require the drug to be metabolized. You don't need a cytochrome-based metabolism or any other enzymes to break down the drug, to be making it hydrophilic and to make sure that the drug will be eliminated from the body. So what is the concept of drug elimination? The substance has to become more hydrophilic where it can be eliminated. Whereas with amantadine, what is happening is, it prevents the release of the viral nucleic acid. So that makes it good. But What is the advantage of this particular drug? It is excreted unchanged in the urine. Okay? So the concept for you to take is, there is a reason for you to understand the structure of the drug. A simple modification of this drug, you can see that alpha methyl derivative is added to the structure of amantadine. What is going to happen to the drug? Two things. How a beautiful change occurs. So number one, I just want to go back to the slide. This particular drug, amantadine, is not only used to treat viral infection, it also can be used to treat Parkinson's disease and extrapyramidal symptoms like tremor. Let me stop there. I'm going to ask you, what is the first criteria for a drug to act in the central nervous system or a brain? There's no wrong answers, guys. If you don't answer only, it's going to hurt me. Somebody tell me an answer. What is the first criteria for a drug to act in the central nervous system? Thank you, sir. Thank you, sir. So, sir told that it's going to cross the blood-brain barrier. Thank you. So, what is the chemical structure that's required to cross the blood-brain barrier? Thank you. This is highly lipophilic. You made my day. Awesome. Am I right? So now what is the criteria that can detect whether a drug is lipophilic? So we are going to see that. So now definitely amantadine is going to be lipophilic. Thank you, sir. It's going to cross the blood-brain barrier. That is the reason we are going to use that in the treatment of a central nervous system disorder. Simple. Now, by making a structural change, we are going to change the log P of the drug. What are we going to make a change? There is a reason for you to study all these things, alright? Sometimes you are thinking, why am I studying this? There's a reason. So, we are going to make sure that you understand that we are changing the log P. By changing the log P, there are two things that we have done. Number one, as a pharmacist, what you have done? You have increased the half-life of the drug. Guys, you have no clue what it can do to a patient by increasing the half-life of a drug. Do you think what is the worst thing for a patient with regard to drug administration? They do not take the drug properly. Alright? Compliance issue. The patients are not compliant. You are telling a patient to take 3 times a day, 4 times a day, are they going to do it? No. But when your half-life increases, now what are you going to do? Once a day. Am I right? So try to understand that as a pharmacist, as a drug specialist, by changing the structure, by adding one methyl group, you have made the drug differentially lipophilic, number one. Number two, you have extended the half-life. So your QSAR just started there. Are you guys with me? I don't want you to memorize that, but try to understand the concept. By adding a methyl group, what did you do? You increase the size of the molecule. Am I right? That's the first concept. Number two, you have changed or you have varied the lipophilicity and also you have varied the log P value. Good. So that is the most important thing I want you to understand. And before that, I'll go to one more thing. Have you heard about the rule of 5? The rule of 5 determines the bioavailability of a drug in the body. Okay? It is based on the structure. To all my chemists who are sitting there. Am I right? The drug action begins with the structure of a drug. A drug is a chemical. Are you guys with me? What were the pharmacists called in 50s and 60s? They were called as druggists or drug specialists. Later on, only from 60s and 70s, the word pharmacist came to the picture. People who are dealing with drugs. Am I right? So a drug is a chemical. So a drug less than 500 Dalton can be a good candidate to be administered to a patient. Are you guys with me? When a drug becomes very big, it is going to have a problem with the bioavailability. So as a pharmacist, the most important thing for you to do is the kinetics and the dynamics. Are you guys with me? Pharmacokinetics and pharmacodynamics should be there at every point of time. A drug has to be rapidly absorbed, it has to be distributed, it has to be metabolized, and it has to be eliminated. That's the concept, am I right? Nothing has to be changed there. So for that, the size of the drug, the weight of the drug has to be less than 500 Dalton. no more than 5 hydrogen bond donors, no more than 10 hydrogen bond acceptors, and then the partition coefficient, am I right? Log P should not be greater than 5. Are you guys with me? So this is the most important criteria for the bioavailability of the drug. So based on that, so from now on when you look at the drug, try to understand the molecular weight of the drug. Try to understand the log P value. Am I right? We are not telling you to memorize that. The whole thing about this, try to understand the concept behind the drug. What is the structure? How does it act in the body? So with this particular ratio, at least we are clear, we covered one aspect. This is the QSAR of the viral drugs. Okay? There are different types of viral drugs I talked to you about, but I started with amantadine and rimantadine by adding a different structure. Amantadine has both antiviral use and also is used in the treatment of Parkinson's disease and tremor. Are you guys with me? So a simple structural change can modify the action of the drug in the body. So now let's get back. Now let's go back to the treatment of COVID-19. Okay, let me go back to one more drug. Okay, one more drug. I'm going to think about zanamivir and oseltamivir. It's a very common antiviral product. It's a very common antiviral product. Again, I'm going back to my structure of the drug. Okay, think about that. Their mechanism is same. Based on the structure of the drug, what is the route of administration? You can see it from the slide. The route of administration is inhalation. Thank you. So now, what makes the drug not to be administered orally? Again, go back to your rule of 5. So now what is the challenge we have as a pharmacist? Why was that required for the drug to be administered by inhalation? Number one, the onset of action is going to be very rapid. Are you guys with me? The onset of action is going to be very rapid. Number two, as a pharmacist, what is the problem? It cannot be administered orally because the drug might be metabolized. Exactly. Before even that, maybe in the stomach, it may not be stable in acidic media. Thank you for the first class metabolism. But there are other criteria to take that. So again, I'm just letting you know, the structure of a drug determines the pharmacokinetic and pharmacodynamic action of a drug. Are you guys with me? Again, the structure of the drug determines that. Okay. Another one point I just want to bring. So here you see that, again the two drugs, am I right? One particular drug can be administered to a patient, maybe a child above the age of 3. The other drug has to be only administered to a child above the age of 5. Are you with me? So now, what is the most important thing as a pharmacist? Yes, I want to know about the drug action. But a drug also has severe adverse drug effect. Am I right? A drug can cause death. A drug can kill a patient. You want to avoid that. So which means, you see here, a simple structural modification has made the drug not to be used for a young child or an infant. Why is that? Because the particular drug may not be metabolized well in the body. The drug is going to be cytotoxic. It can cause hepatotoxicity or it can cause renal toxicity. So that is the big picture. So now one more criteria. Am I right? I'm not asking you to memorize. You cannot memorize. We started with the log P value. We saw the half-life. Now what is the criteria I'm bringing to you? A simple structural modification has made one drug to be used for a patient above the age of 3 months, maybe for an infant, but the other drug cannot be used for an infant. Are you guys with me? So the structure of the drug plays a very vital role with regard to the toxicity of the drug's ability. Okay? Sure. Thank you. Thank you. Okay. So now, let me come to the next drug. Am I right? I'm coming to interferons. So if you have studied antiviral drug, what is the other drug that is being used in the treatment of viral infection is interferons. So when you see interferons, what is the structure of interferons? Interferons are basically proteins. So when I hear the word protein as a drug, what is the first concept that I want you to know as a professional? It cannot be administered orally. That's it. That ends the matter. So now, if you believe that, how is the drug administered? it cannot be administered orally. It has to be given by a parenteral route of administration. That makes it simple. Again, what am I trying to talk to you? Try to understand the structure of a drug. So I bring the next class of medication which is used for viral infection, interferons. I have listed all these interferons. They only change. So when I see a protein, what is the simple aspect I am looking at? Proteins are made of amino acids. That's it. What makes insulin different from glycagon? The different types of amino acid and the structure. Whenever I see the word protein, I think about primary, secondary, tertiary and quaternary structure. You have studied it, am I right? Now let's bring it back. That's what I'm trying to bring back. You are not memorizing it. You are trying to connect with each other. Are you guys with me? That's what we want you to do. Okay? So that's the next concept I want to make sure. Try to understand the structure, and based on the structure, we are designing a dosage form. Good enough. Okay? See, look at it. What are the different dosage forms we have? Subcutaneous, IMIV, intralesional. How many of you know about this particular thing? They administer the drug at the site of lesion. Because of viral infection, you have a lot of skilled lesioning, am I right? So you just administer the drug at the lesioning site. You have this picture. You can see it here. What is the advantage of this, guys? What is the most advantage of this? Administering at the site of lesion only. Number one, action. It's going to be locally effective. You are not going to have any systemic effect. Are you understanding? Why am I thinking about a systemic effect? Every drug has a adverse drug reaction. You completely avoided that. By administering at the site of action, at the lesion site, I'm making sure that the viral infection is not spreading. I'm killing the virus, but it's not having an adverse drug reaction. And why are we doing this particular way? Because the drug cannot be administered orally. Are you understanding? Again, we are going back to the structure of the drug. So, as a young professional, as a young pharmacist, try to understand and try to relate the structure of the drug with the pharmacokinetic and pharmacodynamic aspect. Again, a point made here. Okay? So, next drug, I see a nucleobase, a simple aspect of a DNA. Okay? So now, the next side of drugs, when you see that, am I right? You can see the nucleoside analogs, which means, what do you mean by analog? A simple structural alteration to the basic structure. Am I right? Nothing, ma'am. So as a young pharmacist, what am I thinking about? What is the position? Number one, which position have they added the substituent? Very important. Number two, what is the substituent that has been added? So by adding a substitution, did they make the molecule more lipophilic or more hydrophilic? That determines the duration of the action of the drug. Very simple. If the drug has become more lipophilic, the duration of action is going to be higher as compared to the more lipophilic drug. That is what I want you to understand.